So I'm gonna sound like a hypocrite. What I got done is absolutely crazy. They basically peel your face off. That's not even human. You're an asshole. I think that girl has a You're actually making yourself double ugly. Oh my god. So I'm gonna sound like a hypocrite in this, but let me explain myself. So I'm trans, and I have gotten plastic surgery on my face. It's called facial feminizing surgery. They basically peel your face off, and they soften the bone structure. And I think this, technically, it is a cosmetic procedure, but I think it's totally different than traditional or other cosmetic procedures. Because for me, it's all about associating to society. The way that the doctor described it was like, I have deformities on my face. FFS is not for fem's sake or for F's sake. It's facial feminizing surgery. And for me, you're just fixing deformities. And I'm sure, I guess in their situation, they are fixing their deformities. But I think it's different. I think it's totally different. Technically, it is a cosmetic surgery. And what I'm getting done is plastic surgery. And it is to make myself look better for other people. So I can live a normal life. But I think it's different. Because I'm going from a place of like, not the standard of beauty to normal, you know? These people are starting from like 10 out of 10 faces and they're taking it too far. It'll be like people that already look good taking it too far. And people like me, we're trying to fix an actual deformity so we can live normal lives. Because believe it or not, the way you look matters and people will judge that. And when you do like a lot of facial injections, you will look good for the first couple of months and everything, but then you will get addicted, and I think you do have to keep your maintenance up, and there's probably all sorts of other complications. So at the moment, you look good, but long term, you just turn into a statue. You can't show face anymore, like any emotions, you're just kind of frozen. You look good for pictures and maybe video, but you don't look good in real life. And maybe you're like an online content creator and like you're getting procedures done. That's good at the moment, but later on in your life, it's gonna have complications. There's no way you're gonna be totally fine. I think in my case, I only got bone structure reduced, and I got fat changed, or fat from like my stomach to my lips to make it more like plumpy. That's permanent. Unless I lose weight and then for some reason it's come back. But those fat cells are still there. My bone structure is still gonna be there. It's the injections, and then you start doing like prosthetics into your face. That's crazy. What I got done is absolutely crazy. But I'm just trying to reach a point of normality. Whereas this is something completely different. Let's see what this is about. Pillow face.
Loved by so many to enhance their looks and defy facial aging. Nowadays, filler has gotten itself a bad reputation. There's so much negative buzz on social media surrounding filler, and internal industry stats show that dermal filler sales have gone down. We've been bombarded with pillow faces and sausage lips on television.
Yeah, look at that. That's not even human. And everybody's face is just really puffy. That's crazy. That's crazy. You're not human.
And in real life. And as more and more celebrities and influencers flock to have their fillers dissolved, it leaves so many wondering, should I get fillers? Will fillers eventually migrate and make me look weird?
I recently had an older video surge, and in the video, I spoke about liquid facelifts and tweak.
It makes your lips uneven. And your lips aren't proportional to everything.
That can be done with fillers. And I got a lot of questions, concerns, and it was just one negative comment after the other negative comment about filler. So I hear you, and I want to address all of your concerns and answer all the questions you have, such as,
will filler make me look unnatural? Do fillers eventually migrate? Will fillers eventually make me look fake? After a certain age, should I stop using fillers? Why do so many people who get fillers look weird?
And I'm going to tell you my secret on how I keep my patients looking 100% natural. So let's set the record straight.
Oh, okay, we're watching the advertisement. Okay. Let's see how real, because like, sometimes you will have complications, but she's saying that she's gonna make her patients look completely natural. But if hers doesn't look completely natural.
About fillers.
In 2021, 1.8 million people in the US received dermal fillers.
I don't have this year's stats because it takes the companies a while to gather data, but
take a look at these people. Can you spot that they have filler?
One of the biggest misconceptions about filler is that you're able to spot every person who has it. You have to realize that you're only able to spot the people who look
the bad
unnatural.
ones.
This was an Allergan commercial.
You're only ever gonna see the bad results. That makes sense. Like boob jobs. Everybody's like, oh, I don't want a girl with fake boobs. Because you've only seen the bad ones. When it's a good boob job, you're not gonna be able to tell.
Advertises their line of fillers, and trust me, they would make sure that all the models treated in this commercial look natural looking. Otherwise, it could give their fillers a bad name because people would associate the unnatural look with their line of fillers.
But it doesn't matter what filler brand you use, all of them can give you unnatural looking results in the hands of a provider who goes beyond your natural facial contours or anatomy.
What's happening is people equate those they can recognize who have obviously looking filler to everyone who has filler. Also realize when you see people who look unnatural, you don't know what they had injected. Priscilla Presley and other Hollywood A-listers were victims of having industrial low-grade silicone, similar to what's used to lubricate auto parts, injected into their face by a doctor who wasn't even licensed in the US. It could also be facial fat transfer, which can look unnatural. It could be cement. You don't know if it was a black market product they had put in their face. There is a black market for filler, and even though it's dangerous and illegal to sell hyaluronic acid fillers online, despite the risks, consumers remain undeterred, with many going as far as to inject themselves.
I cannot tell you the amount of messages.
So when you go to a doctor, I guess that's not your fault, because like you expect them to have their license and everything. They're not going to be like, here's my license or registration. They're just going to be like, here's me. But I feel like maybe you should know if it's not a trustworthy doctor, you know? I imagine like it's a gross, dingy procedure office where like the price is too good to be true. There's got to be signs, you know?
I get from people emailing me or DMing me on Instagram asking if I want to buy cheaper products from them instead of buying from the companies that actually manufacture the filler.
Yeah, DIY, people that want to do it themselves at home because it's cheaper just to do it yourself, but you should never self-medicate. You're always going to abuse it. You're not going to have the same self-control as somebody else who's doing it for you.
This is why we can't blame filler for every botch-looking person.
You cannot spot a person who has fillers if their fillers look natural. So, what causes someone to look botched? When a lot of filler is placed into the skin tissue, it can give it a firmer appearance than their skin naturally has. And the most common areas you tend to see this are the lips and cheeks.
In general, you can put 3 to 4 or more syringes of filler in someone's cheeks, and it looks completely natural because cheeks are the largest facial unit, so they can take a lot of volume.
But things start to look weird when you put so much as to go...
That's probably aging, that his eyebrows are kind of down, but his cheeks are up. It's like this weird clown kind of look. It's like clowns will sometimes be like their eyebrows look like they're sad, but they're smiling, you know? You can tell that something is off.
Beyond the person's natural cheek contour, to which you're giving the cheek more convexity and more anterior projection than it naturally had, which you can see with Simon Cowell. His cheeks did not have this anterior projection, and you can see his skin looks more firm. And this is because of too much filler, which he admitted to going too far with. You can treat other areas of the face, like the chin and jawline, with a lot of filler, and it won't be obvious, because in this case, you're mimicking bone in these areas. In this patient, we did around 3 syringes to her chin and 2 to her jawline for a total of...
Nobody's face is symmetrical. But it's like when it's too unsymmetrical because you've done too many procedures, that's when it's like, you've gone too far. Like in this case, the before and after, we can all agree that looks fine, right? The eyebrows are kind of funny because they look like they're drawn on. And this isn't a really good representation because it's kind of like me when I first wake up versus me when I get my lashes, get my makeup done and everything. It's not really a fair picture. Yeah, both look good, honestly. But you can see what they're doing. They're manipulating the picture.
Of 5 syringes.
But when I'm treating these areas, I usually don't do more than 2 syringes at once per area. So let's say 2 syringes to the chin and 2 or 3 to the jawline because I want to allow for adequate tissue integration.
On the contrary, the lips do not take a lot of filler to make someone look unnatural. It's a very low threshold before you can tell that a person's lips have filler in them. And that's because lips are a very unique anatomical area.
That's big.
They're tubular structures bound by distinct borders. So it's obvious when they're over-injected. And I've spoken about this in other videos. What also comes into play, people get filler blindness. And this is a very common thing that happens in lips where they don't perceive how full their lips are anymore. And it commonly happens after a few treatments. Courtney Cox revealed that her dissatisfaction with fillers occurred gradually over time after doctors continually told her that a little injection here or filler there would help. Next thing you know, you are layered and layered and layered. You have no idea because it's gradual until you go, oh, this doesn't look right.
Yeah, because you get used to it. It becomes white noise and it doesn't look right to you. But I still don't get, like, to yourself, I guess you will always view yourself different and viewing somebody else because now you're doing like a mind trick. You look at the mirror, you see something that everybody else doesn't see. Then it gets into like a weird territory.
Another factor that comes into play. Injectors themselves don't look natural.
When I go to cosmetic conferences, I'd say around 25 to 30% of the providers there look like they've had work done to the two most common areas that we mentioned, the lips and cheeks. So if cosmetic providers have lost sense of what a natural looking face looks like, then you can see how this could lead to patients looking unnatural.
Another thing that comes into play is marketing promotions. When practices sell packages like the Kylie Jenner package or lips and cheeks.
That's horrible. If you're an influencer, you're advertising your own package, or maybe not. That's probably like other people stealing their face, being like, hey, you want to look like her? As a content creator, I know you want to look your best because everything relies on your looks. So it's really hard for somebody like me to not want to get something done, right? But then you're just shooting yourself in the foot and you're bleeding out. You're not going to die right now, but you're gonna die later on if you got way too much going on. And it's gonna be really hard to be like, oh, I'm done after this one. It's gonna be really, really hard to just do that. Because why would you want to go back to being ugly, huh? That's what you're gonna be thinking. That's crazy. If you see somebody getting cosmetic procedures, let them know that they look fine. If they want to do it, they can go for it. But let them know that they look fine now. And that maybe there's some distortions in the way that they see themselves, body dysmorphia, and all of that. Especially if you're trans, you probably have an extreme version of that, and you gotta think twice, 3 times. It's crazy. What did you get with the nano treatment? You get elf ears, and bigger nose nostrils to pick your nose,
Comes into play.
and a gummy smile.
Is marketing promotions. When practices sell packages like the Kylie Jenner package or lips and cheeks promotion, as if everyone needs the same amount of filler.
I don't love that idea because you're going against customizing and personalizing treatment to the individual. And you can encourage someone to get more than they may need because they're getting
Just
a
do what
bargain.
they need.
How to avoid pillow face.
Find the right cosmetic injector, look at their before and afters. Do they look unnatural? Go to somebody who provides a natural looking result. And be careful how often you're getting filler retreatments to maintain your results. There's no set time frame that I can tell someone how often they're going to need to get retreated with filler. You can guesstimate, but you shouldn't necessarily think you need to retreat yourself every 6 to 8 months. Filler can last years, especially under the eyes. This is the area of the face where filler can by far usually last the longest, longer than any other area of the face. You have to be especially careful with how often you're retreating your lips with filler. Find someone who isn't afraid to say no. And if you want to learn more about how often you should get lip filler, make sure you check out this video after.
I think you should just ask people and have them be brutally honest. I think the truth is, we all suffer from this problem. Everybody wants a real motherfucker to tell it as it is. But if you tell it as it is, you're an asshole. Nobody likes you anymore. You have no friends. Everyone's gonna talk shit behind your back. But it's like, hey, you wanted a real motherfucker to tell you how it is. I'm gonna tell you how it is, and then it's gonna backfire on you. So nobody's gonna ever do that. Never. It's awful. You have to surround yourself with people, and you gotta let them know, like, hey, I'm doing this thing. I really need you to let me know if it's good or bad. And it's gotta be somebody that you can actually trust. Like, if I'm trusting you guys are gonna be like, oh, you're fine. Don't worry about it. You guys gotta be brutally honest and be like, yeah, too much. That's crazy. Back in my day, we used to stay ugly. Amen, brother. Ball size 500. Amen.
All fillers eventually migrate. Filler migration is when fillers move to areas other than their initial intended injection sites.
Another common misconception is that
all fillers eventually migrate.
this is not true. Fillers do not all eventually migrate. Migration can happen, but
true filler migration is still one of the least common, least problematic complications from filler.
certain areas of the face are more prone to having issues with migration, and the 2 most common areas are the lips and under eyes.
Why the lips? The lips are the most popular area of the face to treat with filler.
So this is the before and after? She looks great before, and she looks fine after, but I can kind of get the idea that she's gonna have like a statue face. You know what I mean? Like FFS, I think is completely different because we're alleviating. I guess you are alleviating an issue here, but I think it's totally different. Don't do it.
Because it can really enhance someone's look and their sex appeal, which is why it's so addictive, driving people to push their anatomy past its boundaries because they think more is better. This is why migration is most prevalent in
I think I've seen her. I think that girl has a cock. I can find you who that is. I see her on Reddit every single time I'm on.
anatomy past its boundaries because they think more is better.
She looks
This
fine,
is why migration is most prevalent in the lips.
The second most common area is tear troughs. Hyaluronic acid fillers can attract water. They're hydrophilic. And when it comes to the under eye area, this is a very unique anatomical area. The skin is thin, so swelling is obvious. And the lymphatic vessels in this area are fragile and compressible. And sometimes adding filler to the under eyes.
Also, guys, if you want to like have your face be like, if you want a pretty max or whatever, don't touch your face. As much as you can, avoid touching your face. If you're stretching your skin, like putting your hand on your face, you're stretching your skin, you're gonna have wrinkles. Ball sack. When you stretch ball sack, it's smooth. And then when you let go, it's wrinkly. Look at your face. Same thing. You're gonna be stretching your skin. Don't touch your face as much as you can. If you're washing your face, be gentle. Drying your face, pat it. Pat dry it. You gotta be gentle, especially under your under eye. The skin is like 10 times thinner. I think your eyelids are way thin. And that's how you get like the dark under eye things, because as you touch it, and you're gonna like bruise it basically. You're gonna ruin it. But if you stop touching it, it'll go back to normal to a certain extent. You get what I'm saying though.
Pulls in water years later and can block lymphatic drainage, which can lead to persistent swelling.
I attend aesthetic conferences every year, and this year there were a number of lectures on the issues with under eye filler swelling that can happen years later after injection. Aesthetic providers told story after story of treating patients' under eyes. Everything was fine,
rare.
and then maybe 8 years later, their under eyes started swelling out of nowhere. And some of these providers were heads of plastic surgery departments at
You're
universities.
putting fucking automobile fucking oil under your skin. Of course your body's not gonna like that. Oh, I'm gonna use corn oil. No! It's not. Don't do it. Don't do it.
So they obviously were experienced and knowledgeable in treating the patient's under eyes.
This is a known issue with filler to the under eyes. And if it happens, it doesn't mean that your provider necessarily did something wrong or injected you with the wrong technique. Whether they use a needle or a cannula, it doesn't matter. It can happen. This is why I've gotten more selective about patients I treat with under eye filler. In general, filler to the tear troughs can last several years. And some people even say it can be permanent. I can attest to that. I have under eye filler. And this swelling years later is not a known issue with other areas of the face. And before you disagree with me, I'm not talking about the hypersensitivity reaction that can happen anywhere you get filler on the face.
Right.
That's something completely different, which can resolve on its own or with oral steroids. It's not the same thing as migration or this delayed lower eyelid swelling that I'm describing now, which can sometimes happen after getting filler to the under eyes. So if you want to treat your under eyes with filler, just know it can look great for years, and then later you can develop swelling. And if that happens, you can always have it dissolved and start again. That's the great thing about hyaluronic acid filler, is that you can always dissolve it.
What do you mean have it dissolve? I guess you have like another chemical agent and you just kind of like do a chemical reaction to dissolve it, you know? Or do you like poke a hole into your skin? You pop it like a zit? Probably the other one.
Out any damage to your tissues. Guys, if I had this many issues with filler migration, and I think I speak for the cosmetic industry when I say this, no provider wants to have to deal with managing complications that are so high. If I were having that many issues with migration whenever I did filler, I wouldn't offer this treatment, period.
But why
I just
people
focus
look
on
like that?
Botox, biostimulators, and peels.
That's why Quo, an FDA-approved cellulite treatment, went off the market because it had around a 10% rate of causing hemosiderin staining, which could last
10% odds. Guys, there's a 10% chance you look a little bit hotter. Oh, it's probably the other way. 10% chance that you don't look hotter. 90% chance you... Okay, those are pretty good odds. I get it. I get why people do it. I get it.
for several months to over a year.
It did a good job treating cellulite, but the complications were too high.
You're going to gamble with 90% odds. 90%? It's not going to be you, baby. It's going to be somebody else. I get it. But then, if it's you, 1 in 10 people, oh, a bad time.
After a certain age, will I have to stop using fillers because I'll look fake?
Yes. And no, let me explain. If someone is keeping on top of facial aging, which is the best way to go about it with non-invasive injectables, as we've discussed in this video, I do think that at a certain point in time, you cannot continue to solely rely on filler to restore the lost volume to every single area of the face. And when I say filler, I mean hyaluronic acid fillers and Radiesse. I believe that it could lead
fillers.
to someone...
The whole point is to make your face look rounder, right? Filler. Am I thinking about getting fillers? No. If you see anybody thinking about getting fillers or stuff like this, tell them that they look fine. Don't tell you like, no, you can't. Just tell them they look fine. I just saw like a TikTok where people have the pillow face where it's like really swollen, like they don't look human anymore. I just wanted to see more. It's just why? You gotta go too far. They get like face blindness and they don't realize when they're too far.
looking unnatural. Why? For the same reason we discussed earlier. When a lot of filler is placed into the skin tissue, it can give the skin a firmer appearance than it naturally has. So if someone were being
wait, I was gonna say, so the whole point is to make your face look rounder, right? What if you just gain weight? Oh my god! What if you find a healthy way to gain weight? Everybody here that's overweight, this is what skinny people have to go to find happiness. They don't know about the Krabby Patty meal. They don't know about the McDonald's app where you get $1 fries and $1 drinks. Wouldn't it be easier to and happier if you're just like, hey guys, we're gonna eat a little bit more and we're gonna go to those favorite places. Gain weight only your face? Yeah, you probably can't pick and choose. Yeah, tricky dicky.
Aging, you're going to eventually benefit from global volume restoration because the face ages everywhere. And ideally, you want to come in before all your results are gone. And in this case, you can accumulate a lot of filler into the tissue and it could give it a more firm, unnatural appearance.
You're gaining weight, noticeably in the face? It's crazy. Yeah, everybody likes that. That's the meta. Actually, no, I think the meta is to have, it's the opposite. There's that one artist, Starlight. I don't know what that's her stage name. I don't know what her thingy name is. But they remove your fat from your cheeks and you look like a skeleton. Or they add a prosthetic chin or something and you just look like a skeleton. And you're like permanent Giga Chad. Fat lips, no cheeks, and everything's sunken. It's that looks horrible. It's crazy. Buccal fat removal, yes.
Don't like using filler everywhere on the face. I don't like using it to the temples, the lower cheeks, the lateral areas of the face because filler just doesn't spread well in these areas. And although filler can do a great job restoring volume to the temples and it gives immediate results, I personally don't love the way it feels. I had my temples filled with Radiesse several years ago.
I don't have a fat
you can feel it. And I've had other patients who have had filler to their temples say the same thing. They don't love the way that it feels.
Yeah.
Now, if someone was using filler for global volume restoration and let's say they let all their filler dissolve on its own before they got retreatments, then I don't see how that would result in an unnatural looking appearance. But then you're letting all the filler dissolve and you're not staying on top of facial aging if you're letting all your results go away. That's not the best approach to maintain your youthful look because you're going to see volume loss. You're going to see wrinkling.
Yeah, you're hooked on it. If you get one filler done and it dissolves, your skin went from stretched to unstretched. Ball sack again. You're stretching in, you're unstretching. You're going to get wrinkles really fast. So by trying to make yourself pretty, you're actually making yourself double ugly, double XP ugly. You're making it faster. So you can look good now, but then later on, if you don't keep up with the treatments, then you're screwed. So every person that's oh, I'm only gonna do this one treatment, they're lying. They can't keep it up. Because they're gonna ruin their face really early, so they have to keep it up so they don't ruin their face this early. That's crazy. Dude, why does this exist? That's crazy.
Or loss of elasticity to the skin when the filler goes away.
Why is there so much negative buzz on social media surrounding filler? Social media is blowing migration out of control, making it seem worse than it is in terms of numbers because trend cycles are speeding up. And we spoke about this on other videos.
Oh, they get
There's
facelifts
also the
and eye bag
negativity
reduction.
effect or negativity bias.
Yeah.
Things of a more negative nature have a greater effect on our psychological state.
Let's say you got a new outfit and you get a lot of compliments on it, but then one person says it's ugly. Even though you got all...
It's more like your face is frozen and an age catches up to you all at once. That's what you think it is, but you're stretching your skin and when you let go of it, the skin has already been stretched. What's going to happen to the extra skin? It's going to stay there. You don't just lose that extra skin. It's going to stay there. Isn't that what happens to people that lose a significant amount of weight? They still have the skin. That's what's going to happen to your face.
These compliments, you just can't help but focus on that one comment that it was ugly. Our minds will give more focus to the negative. So even if you have people who get filler, they're happy with it, no issues, they look natural. Remember, you don't know who got filler if they look natural unless they tell you. Your mind will always be focused on the negative. This is why negativity dominates.
But they're double XP and they're ugly. They're gonna get hit harder later. That's crazy.
the news.
What's my secret to keeping patients looking 100% natural?
I like to use fillers for enhancements. For example, someone wanting a natural lip enhancement, a chin enhancement, a jawline enhancement, because filler enlarges and expands the tissues, allowing facial features and anatomy to go beyond what the person naturally has. But I like biostimulators for anti-aging, or when I need to restore the loss of volume globally to a face. But not in every case. If I wanted to restore someone's lips and the tissue surrounding the lips, I have to use fillers. You can also use fillers for the dorsal hands as well. So right now, filler will always have its place. Now, sometimes I like to use fillers for anti-aging if someone's wanting immediate.
You know what? I'm going to say it. If you're a content creator, your value does depend on your face. So it does make sense for somebody like me to get something done. But that's not the case anymore. That's boomer. That is caveman status to get work done on your face. We have filters. And AI stuff, deep fakes, are getting better. You don't have to ruin your face, spend money, and ruin it, and all of this. We have camera filters. And they're getting bigger, better, and more popular. And they're becoming super, super, super toxic. Because they're presenting everybody a fake face. But at least you'll be healthier. Which one is worse? At least you can be healthy with one, because in both you're still doing manipulation. And VTubers, yeah. That's crazy. If you see somebody considering this, let them know that they look fine. You're not going to convince them otherwise. But give them that confidence that they need to be like, you look fine. Trust me. If you look ugly, I'll be the first one to make fun of you for it. Lamau. Those are the best people to have around you. But at the same time, people are like, why would you hurt my feelings? That's a great video. She did not convince me. In fact, it's the opposite. She managed to do the opposite. That's crazy.